when I started working with the team with whom I ended up founding Cyted together, the clinical need became very, very obvious quite quickly. There's obviously an interesting point in there, and you said it already earlier, Steve. If you just have a device, which in our case is a capsule sponge technology, so it's a small sponge inside a capsule, patients can swallow that, goes into the stomach, capsule dissolves, a small piece of sponge expands, and you can then withdraw that. Sounds uncomfortable, is actually not bad, and much more comfortable than getting an endoscopy, in case any one of the listeners ever has gone through one. That's certainly a lot more unpleasant. But what are you going to do with this? You're going to give this to a GP or to a GI clinician, and they're going to collect some cells, and then so what? What's going to happen with that? So the entire combination of what biomarkers are relevant at a very early precancerous stage, together with the device, together with understanding where in the pathway it needs to be delivered, was something that was, between 2018 and 2020, there was a lot of work going on, which was more in the academic setting for us to understand that. Then we decided to form a company around it. COVID started, and within a matter of months, we were asked to roll this out into a national program, demonstrating that, okay, if there's pressure on, in this case, it was elective services like endoscopy, and there are triaging tools or adjunct testing tools available, then suddenly, the clinical pathway can leap by 5 to 7 years, over usually going through, very trickled adoption over a number of years, which wasn't the case for us, but very much accelerated by COVID, because otherwise we wouldn't be in the situation we are in right now. We would probably be running, some larger commercial pilots now in the UK, but we wouldn't be in pretty much 80 sites, and covering the entire UK. So yeah, I skipped a few steps here because there's a lot of considerations. There's a lot of considerations that went into the why does it fit in the pathway, where it sits right now, how are clinicians dealing with the information they're getting back from a test, which is a new intervention in a pathway where there's currently no intervention. Playing to my point earlier on, if there's no baseline, how do you work with clinicians that have never come across something and that tells them that they should do something different or maybe the same? But again, it's something else that tells them whether they should do it. It's not their own experience or their own interpretation of guidelines. There's a lot of color in those grayed out areas, which I just outlined, and it's on the back end. We have developed a lot of digital tech tools, to support and aid the delivery of it, and there's much more coming later this year and next year. But we had this. I think we had this curse and blessing of vertical integration. Earlier, I talked about it as as if it's the solution to everything. It makes it very difficult to build companies because, as you both, or as everyone can imagine, that probably listens to this, is having a company focus on one thing is already difficult. Now let it do 4 things, and all of these 4 things have to be done really well.